Are you unsure about the SCA? Maybe you've been preparing with colleagues, but you're not sure whether you're getting the right feedback. A common reason why GP trainees fail is that they're not getting constructive feedback. In this way, I'm going to pull back the curtain so that you can learn from one of the immersive workshops we ran. You'll see how constructive feedback can have a major impact on your progress. So if you do follow everything and then you don't know which one is a cue and you can't identify, it's going to be an issue where you're dwelling on the data gathering. When you're consulting a case, record it. Once you watch it back, you will find that there are cues that were missed. So usually these cues in a consultation, you'll find that the patient might drop another cue at some point again. If you have missed it second time, they might not actually bring it back. So sometimes it's completely gone and you won't hear from it again. Now sometimes you might find that the patient might ask you a question later because you didn't readdress the cue. Like in this case, one of the cue was that he lives far away. Okay, and then later he was asking whether the dad is going to be staying in the hospital because he was concerned that if his dad does not stay somewhere, it's not safe. Do you see how the cue came back as a question? So it's more about how you interpret this information and know where it's a cue worth following in, and also understand that you have to stay focused in the history. You can't just keep working and trying to find out more about everything because you have to be selective. This is very difficult scenario where you're having to negotiate and you've got a patient who is demanding sleeping tablets, but you know that this might not be the solution. And in negotiation, it's important in the beginning that you listen, ask insightful questions to help you understand where they're coming from. So here we would want to know a bit more about the sleep cycle, his night shift worker. That will help us understand why he's not getting a good quality sleep and explain the problem with the patient, telling him that sleeping tablet it might not help him to get good quality sleep, although he might be sleeping. But what we are optimizing for is sleep where he's able to feel restored. So that will help in your explanation, as in what you're trying to do. And once you've negotiated and given them an alternative option that might be acceptable to them, they're going to be open to the lifestyle changes afterwards.
So you were very patient with me, actually, because I was an awkward sod, wasn't I? I really was. I did feel you listened to me, but from the get go. But when I said I just want these tablets, I just want these tablets, I just want these tablets, I think it would have made me feel more comfortable if you'd have said, yes, that's not a problem. We can do that straight away, or an alternative. However, let's look at now the reason why you're not sleeping. Let's approach it once the tablets have had their effect for you. What else is going on in your life that's causing this? I think that would have made me think. Because I was quite belligerent. I just wanted to get tablets and get the hell out. But obviously, there's other reasons there. So, and then when you offered me different type of tablet, that was okay, that was fine, because then I thought, okay, this other one's a bit addictive. I'm not a junkie. I said, not that. That's fine, that's good, that's great, as long as it helps me to sleep. But I was quite forced about the caffeine drinks because all the drivers use them. That's how we get through the night. I'm still not totally convinced that I'm going to stop taking those.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down in the description below to book a call with me to see how I can help you to pass your exam. When you have management of a chronic disease, it's really important that you're thinking about what are the treatment choices you've got. So you need to tailor it to the patient. So in this case, if a patient has got type 2 diabetes and they've been taking the medication regularly, but despite that the blood sugar level is going up, then we need to tell them what's a number, because when we give the patient a target, letting them know what's the number we're aiming, it's more likely for them to be incentivized to work towards that number. So for example, let the patient know your blood sugar level over the last 3 months has gone up to 67. What we're aiming for is for it to be around 50. So when you explain this to the patient, then they have got a number to work with. Then you can discuss about the fasting, about Ramadan, and what are the changes. So with regards to the medication that the patient did ask, it's important to readdress it. So for example, if they've read about this injection that allow them to lose weight, we can tell them that this is one of the anti-diabetic medication that we could consider down the line. We don't tend to start this medication um, early on because there are other medication that's more suitable. So what I'd like to discuss with you is medication called dapagliflozin, which is very effective as an additional medication to the metformin that you're already taking. So the dapagliflozin, it's going to help to shift some of the glucose, which is the sugar, in your urine so that you pee it and you're not going to have that high level of blood sugar. So there are things that we need to talk about with this. As with any medication, it has got side effects. So side effects would be that it can cause some people to have infection in the urinary tract, can also have skin problems with it. So if you do have any pain or any burning, then please get in touch with us. And also it's recommended that you drink good amount of fluid. It's good what you offered with the weight management. I think the way that you're explaining it needs to be more refined because there's not enough confidence. So if you're talking about it but not a lot of confidence, and it doesn't feel like the patient would want to take it. So what I would say here is that it's good that you have started to make some changes, and there is a weight management service who's got a team of experts who could help you to give you more specific advice with your diet, exercise to help you to continue on this vein. Would you like to be referred to that service? Raise your energy a bit more and speak with more confidence, and you will see that your pace is going to get better. In terms of the management here, you could actually ask a patient to book an appointment for a follow-up with the nurse, the diabetes nurse, so that they can be reviewed and then have a blood test repeated in about 3 months' time to see the response. When somebody is fasting and is taking this medication, it is worth considering whether this patient might need to test their blood sugar. So that's something worth mentioning. And also explaining to the patient, if you do feel like you're going to have a hypo, then it is important that you break your fast, because as someone who has got diabetes, you're exempted if for health reason not to fast. So if it ever happens where you may need to break your fast, then make sure that you've got something sweet with you. You could give the gliptin. However, the because this patient has got hypertension, then there is a benefit of going with SGLT, because SGLT provides protection to the heart. That's a justification, but gliptin would also be something you could consider. Okay, if for example the patient tells you, I don't like this because I have to go to the toilet frequently, could I try something else? Then you could let them know about a different medication. For example, linagliptin, you could say. When somebody's got acting strangely and behaving out of character, we need to have a way of processing this information and thinking how we're going to make an assessment here. So has this patient had any fall recently, any head injury, any fever? When he mentioned about the fact that his dad actually had an accident, passed urine, we need to check, has your dad had any problems passing urine before? Is this the first time? And has he mentioned any pain or burning? These are questions really important to find out what could be going on. And then that will allow you to understand a bit more what could be the reason here. But if you don't ask this question, then it's going to be difficult for you to come to working diagnosis. So for example, if the son is thinking it could be dementia, then you might want to ask a bit more questions to find out whether there has been any problems, as in is he confused when you're talking to him? Does he know where he is? Like, these questions are quite helpful. Do you see how you target your history? If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye bye.